Thank you for joining us for today's webinar to quickly empower you with up-to-date clinical information and assist you with result interpretation. This is a brief educational webinar examining the interpretation of benzodiazepine results from Aegis Sciences Corporation. We will discuss unexpected negative and unexpected positive benzodiazepine results and their potential causes. Takeaways will include overview of benzodiazepine metabolism and detection, scenarios that may explain unexpected results, tips for ordering benzodiazepine testing and indicating prescribed drugs, and where to seek out additional clinical support. My name is Dr. Savannah Clary, and I am a member of the Aegis clinical team. I will be presenting today's webinar. Those who missed the live presentation or would like to hear it again may find a recording of this presentation on the Aegis website at www.aegislabs.com. Please call 1-800-533-7052 if you need assistance in accessing this recording. Hello, everyone. Let's jump right in. We hope you have enjoyed the webinar series discussing various aspects of unexpected result interpretation. As you have learned throughout the last few months, interpretation differs according to whether the test is presumptive or definitive, and we will primarily focus on definitive test result interpretation today. Positive Aegis benzodiazepine results undergo definitive testing by liquid chromatography and tandem mass spectrometry prior to reporting. It is important to understand benzodiazepine metabolism to support correct result interpretation and also to properly indicate prescribed medications on the laboratory requisition. In case of unexpected positive benzodiazepine results, consider the following drug exposures: chlordiazepoxide, chlorazepate, diazepam, oxazepam, and temazepam all share common metabolites, and distinguishing which compound was ingested may be impossible. Because the exact ingested drug may not be distinguishable due to the overlapping metabolic pathways, positive results for nordiazepam, oxazepam, and/or temazepam are reported by Aegis as benzodiazepine metabolites. We'll discuss the metabolism of these drugs in more detail in just a moment. Some commonly prescribed benzodiazepines have unique metabolites, which make identification much more straightforward. Alprazolam metabolizes to alpha-hydroxyalprazolam. Clonazepam metabolizes to 7-aminoclonazepam. Lorazepam metabolizes to 2-hydroxyethylflurazepam. And lorazepam metabolizes to lorazepam glucuronide. These four medications are reported distinctly. Let's take a closer look at the benzodiazepines that share common metabolites. Note the analytes in red boxes below that are both metabolites and drugs available as a prescription. This diagram may be helpful in attempting to determine the possible source of exposure when reviewing results. The analytes marked with gold stars are the markers reported as benzodiazepine metabolites. Any one or more of these, nordiazepam, oxazepam, and/or temazepam, is reported as benzodiazepine metabolites. We'll take a look at how this matches up with the requisition form in just a moment. When a patient is unexpectedly positive for a benzodiazepine, a provider may begin to search for possible avenues of exposure as they prepare to discuss the results with the patient. The following circumstances may present opportunities for exposure. A prescription. Benzodiazepines are controlled substances, and legitimate prescriptions would show up on the Prescription Drug Monitoring Program, or PDMP, in most cases. Please note that chlordiazepoxide, when administered with clendinium, which is a combination drug with the brand name of Librax, is not a controlled substance in many jurisdictions, and it may not show up on the PDMP in these states. Procedural administration. A benzodiazepine may be administered as an anxiolytic or as a sedative prior to a medical or dental procedure. If the medication was directly administered to the patient by the treating provider, record of this may not be part of the patient's PDMP report. A review of medical records may be necessary to determine the medications given to the patient prior or during a procedure. Check to see if the patient has recently been hospitalized or visited the emergency department. Patients who arrive at the emergency room with a suspected poisoning or overdose may be given benzodiazepines, depending on their presenting symptoms and the source of the toxicity. A benzodiazepine may also be given as an anxiolytic or pre-procedurally or for treatment of a seizure if needed. If the patient reports a recent hospitalization or an emergency department visit, it is recommended to follow up with the hospital to determine what medications were administered to the patient. And finally, consider illicit exposures. Sources of illicit exposure may include use of another person's prescription drug, acquisition of counterfeit or other illicit drugs that are unknowingly laced with benzodiazepines, or exposure to illicitly manufactured benzodiazepines, which may share common metabolites with FDA-approved benzodiazepines. In many cases, the result interpretation may be clarified by correctly indicating the patient's prescribed medications when ordering testing. When medications are marked as prescribed on the laboratory requisition, this impacts the compliance calls that are issued on the report. This reference chart shows the medication prescribed, what should be marked on the requisition form based on whether the requisition is electronic or on paper, and what the expected result will look like on the final report. For example, if alprazolam is prescribed for the patient, it is only necessary to mark alprazolam as prescribed. Any other benzodiazepines marked as prescribed will create additional compliance calls on the report and potentially confound the interpretation of the results. This chart is also helpful in distinguishing if the results are from the ingestion of one benzodiazepine or if there was potentially exposure to multiple benzodiazepines. If you have questions about how to properly indicate the patient's current prescriptions on a requisition form, our client services team is able to assist with those inquiries. You're welcome to call them at 1-800-533-7052 with any questions on this process. The period of detection for benzodiazepines varies greatly according to the specimen type utilized for testing and the patient's dosing regimen. Benzodiazepines may be detected for a longer period of time in urine compared to oral fluid and blood. In blood especially, the period of detection is generally limited to very recent use. The detection time may be less in all specimen types in cases of as-needed dosing or ingestion of low doses. In settings of abuse or detoxification, the period of detection may be longer. Diazepam in particular has been noted to be detected longer in the urine of obese patients. Patients who have short gut syndrome or have a history of gastric bypass surgery or who have had a recent gastrointestinal illness involving vomiting or diarrhea could have reduced absorption of drug, potentially leading to unexpected negative results. There are also multiple mechanisms by which a patient may produce dilute urine. Some of these are unintentional, some intentional. Aegis has extensive resources to help you with the evaluation of specimen validity and deciphering potential causes of dilute urine. We provide special report comments that alert providers when the urine creatinine falls below 20 milligrams per deciliter. Urine samples with such a low creatinine level are less concentrated, and urine drug concentrations may fall below the reporting threshold in such samples. Elevated urine pH may be a physiologic response to regulate the body's acid-base balance, or it may be also elevated if the urine was not stored properly prior to shipment. In the case of improper storage, drug degradation contributing to unexpected negative results may be possible. We'll discuss a few known stability issues on the next slide. Finally, dialysis treatment can impact drug detectability. It is recommended to test dialysis patients prior to dialysis or at least on a non-dialysis day to reduce the possibility of unexpected negative results. Some dialysis patients are able to produce urine, but the urine produced may not be the result of normal filtration and excretion of drug, and as such, this urine may not be clinically useful for drug compliance testing. Clonazepam in particular is more prone to stability issues. Loss of 7-aminoclonazepam in urine averaging 43% have been reported under refrigerated conditions at 2 months. A 76% drop in clonazepam concentration has occurred in an oral fluid specimen stored at room temperature overnight. Complete loss of clonazepam in oral fluid has occurred in 7 days at room temperature, and in oral fluid, losses of 7-aminoclonazepam up to 20% and 33% have been observed at room temperature and refrigerated temperatures, respectively, over a week's time. Providers may consider these known issues, particularly when evaluating unexpected negative clonazepam results. These stability issues, along with as-needed dosing or low doses, may further increase the likelihood of unexpected negative results. Some point-of-care testing devices, or POCT devices, may result in a false positive for benzodiazepines in patients who are taking certain medications. Cross-reactivity can occur with this type of testing among drugs with similar chemical structures. Non-benzodiazepine prescription, illicit, or over-the-counter drugs would not cause a false positive for benzodiazepines or benzodiazepine metabolites on Aegis definitive testing. Please review this table for a list of drugs which may cause a false positive for benzodiazepines on point-of-care testing. Please refer to the package insert that came with the point-of-care testing device being used, or contact the manufacturer for more information regarding which drugs may cause false positive results. This information may differ among devices and manufacturers. False negative immunoassay results may also occur due to failure of the assay to react to drug-specific markers such as alpha-hydroxyalprazolam, 7-aminoclonazepam, true 2-hydroxyethylflurazepam, and lorazepam glucuronide. Before we wrap up, I want to tell you how to get in touch with us for additional clinical support. The individuals pictured on your screen are my colleagues, the clinical pharmacists of Aegis Sciences Corporation. We are ready and willing to take your calls and emails regarding today's content or other questions you may have about result interpretation or drug testing in general. The information covered today is also available in a written form, accessible online at www.aegislabs.com. Go to Resources, then Clinical Update. At Aegis, we understand your concerns as you evaluate definitive drug testing results. Unexpected benzodiazepine results may be indicative of noncompliance, drug misuse, or diversion, and we welcome your calls and emails for assistance in interpreting these results. Thank you again so much for joining us today, and have a great rest of the day.